Hello, everyone, and welcome to Combat COVID-19 Support. My name is Dawn Creech, and I'm leading up the Advancing Integrated Care in Central Oregon project and bringing you Combat COVID-19. Today, we have a super exciting topic on dealing with older adults who may have a lot of worries during COVID-19. And we have a fantastic guest speaker, Tim Malone with Gero Care Solutions. But before we get started today, I did want to explain a little bit about what Combat COVID-19 is. We are an informal coalition of healthcare providers and other community leaders in Central Oregon, and we're working together to produce a series of live stream video events and virtual groups really focused on how to care for you and your family's health during the pandemic. I did want to give a really quick plug for some of the other events coming up. We actually have another live event today at 2 o'clock. If you or a loved one have diabetes, Dr. Monsha is going to be doing a great presentation on how to care for your diabetes at home during the pandemic. And then we have a fantastic lineup of live events next week. And just giving you a little preview of some of those, we have one on immunity and COVID-19. That's a real hot topic right now. That's April 16th at noon. And then at 6 o'clock on that same day, we're going to have one called Feeling Depressed? You're Not Alone. So please go ahead and visit our Facebook page. You can like our Facebook page and see a schedule of live events. Also, we're now streaming to YouTube. So there's a link right there to our YouTube channel where you can subscribe and view the events live on YouTube. So before we get started with Tim's presentation today, my lawyer says we do have to go over this really boring disclaimer, so bear with us for just one moment. This event is provided for informational and educational purposes. It is not offered as medical advice or medical opinions. You should not treat this event as a substitute for professional medical advice. If you do require assistance with any mental health or medical issue, please contact your healthcare provider. We make no guarantees or warranties of any kind, express or implicit. So with that, I am super excited to introduce Tim Malone, and I'm going to hand it to him right now.
Good morning, everybody. Tim Malone here. It's a fine morning here in Bend, Oregon. Thanks for tuning in. I'm going to talk about older adults and worrying or being anxious in difficult times. This is kind of aimed at older adults and or their caregivers or family members who are kind of helping them through these times. So I'm just going to dive right in. There'll be time for questions afterwards, so please do so. Okay, so start with the basics. What is worry? Per the expert Webster, he's expert in everything. Worry is simply tormenting oneself with unpleasant thoughts. It's a sense of mild uneasiness. It's future oriented. What's going to happen? That's a piece of whatever it is you're kind of obsessing over. What is going to happen is a piece of it. Anxiety is a much greater degree of worry. You're actually feeling distressed or really uneasy, caused by some feeling of danger or misfortune. It's a state of apprehension and or psychic tension. It too is future oriented, but often with a deep sense of foreboding. It's common, it's diagnosable, and is quite treatable if it reaches that point. On the continuum, worry, is a piece that leads to or can lead to, doesn't always, of course, to anxiety. It's from a little bit more normal sense of worry to, a diagnosable mental health issue. Okay, so I'm going to talk about brief signs and symptoms. You've probably all heard, symptom of this or that's a sign of this. I'll tell you what that means. Believe it or not, a lot of people don't know. A sign is what others seem to perceive or notice about you. And that would include your family members and friends, caregivers, care facility staff, your primary care provider, and other medical professionals you're engaged with. Signs can be visible behaviors, something you're doing, and or any other kinds of expressions of distress, such as, breathing changes, increased heart rate, etc. Signs are what family and caregivers report to each other and to you, and potentially to your primary care doctor if necessary. Okay, so a symptom is what you are actually feeling, physically, cognitively, emotionally, or all three. It's something you sense and or are experiencing that is either not right or just doesn't seem normal to you. Uh, these could be anywhere from mildly uncomfortable to extremely distressing and even painful. Symptoms are what you tell your family or your caregivers or your doctor about what's going on with you. Okay, so signs and symptoms combined will help determine what you, your caregivers, your family do about them. And it's necessary, including your doctor. So being aware of problems, concomitant problems, those that kind of like to tag along with anxiety, depression is very common adjunct. Being aware of its signs and symptoms, which I'm not going to go over right now, but in older adults, it's almost a given that if you have one, anxiety, you're likely to have the other. Whichever one starts first, the other one's going to kind of jump aboard. That does not necessarily so. If you're just kind of worrying and excited about what's going on now, doesn't mean you're going to be depressed as well. Isolation and self-isolating, in particular, different from someone else isolating you, is something people do when they're feeling uncomfortable or distressed, or they don't want to bother someone else with how they perceive themselves to be feeling. Loneliness, a deep sense of feeling unwanted aloneness. And that's why you can be lonely in a crowd. It's a sense of being alone. Okay, with anxiety, all these feed on each other, and they can cause and or worsen any of the others. It's actually a geriatric syndrome, a rather dangerous one, to have depression, isolation, loneliness, and anxiety all at the same time. Okay, but substance abuse of many kinds is a common go-to response. So we're talking alcohol, over-the-counter medications, particularly sleep and cold medications, script meds, improper use of those, street drugs, which can include some script meds, of course, food, but especially junk food. So these can all occur together, and if so, again, it's a serious problem, usually requiring an intervention by doctors, mental health therapists, a consultant, or all of the above. So signs and symptoms of excess worrying. Okay, so anxiety is actually the number one mental health issue for women. It's the number two mental health issue for men, with substance abuse being the number one mental health issue. Okay, common and normal, see normal in quotes there because it's different for different people. Fears and phobias are magnified by social confinement, social distancing, and forced aloneness, lack of socializing. All those are going on right now for all of us. Okay. Social phobia, I'm not going to go into exactly all what those are. They're just, maybe your specific kinds of fears and whatnot. Can become pathological if they get very, very bad. But women are often ashamed of their coping strategies, what they're doing to cope with their fears or worries. Men fear looking weak, so neither tell anyone about it and don't seek help. Thus, the problems are going to worsen. If we don't get the help we need, things just get worse. We know that about physical illnesses, of course. And when people who have that sensitive nature, or just kind of a sensitive person in general, and people know that about themselves, these things tend to have a bigger impact. There's higher rates of worry and anxiety. So, false, sensationalized information. Do we have any of that going on right now? A whole bunch of it, don't we? So that and too much news tend to exacerbate the normal concerns for ourselves and our families that we're currently experiencing. So a big thing is cable news addiction. And I don't care what your political orientation is, it's happening across the spectrum. But, it's somebody who's just watching news and commentary constantly. My own dear mother, 24/7. Okay. And it didn't do her any good at all. So then there's this kind of again, we're looking at signs and symptoms of worrying and anxiety. Fortification is how I term it, of home and self, beyond what is necessary. You see, funny pictures on the internet now, people in all manner of crazy getup going out to the stores to keep themselves safe and whatnot. That can get to, even a dangerous degree. But a focus not on self, but on family safety without concern for self. And that can be excessive and even invasive. You're trying so hard to take care of others that it actually, they're starting to really not like it. Okay, more signs and symptoms. Again, the new and excessive concern or obsession with the signs and symptoms of COVID-19. Yes, we need to know them, but having just a really overblown concern, anything you're feeling, oh my God, is that COVID-19? You can only really talk and think about COVID-19 and related issues. And this can begin potentially the beginning of some compulsive behaviors, such as the one we always talk about first is, washing your hands and things like that. Yes, we need to wash our hands and other things, now more than we ever have, but that can get out of control as well. The new onset or increase in alcohol or drug intake. Okay. So again, the increase. Yeah, the guy had a beer once in a while, but now he has, 6 beers a day. That's not a good sign. Okay. And now people often the first sign would be needing something to sleep or even just calm down. Again, sleep, over-the-counter sleep meds and or cold medications. This can be new onset, or maybe they always took a sleep med, but now they need 2 or more to really make it happen. So sleep issues are very common in when someone's worrying too much. You can't turn off the thoughts, right, automatically. So insomnia or hypersomnia, which is sleeping too much, again, new or worsened. And somebody in either case, whether they're sleeping too much or too little, are going to present as being simply tired all the time. Okay. So people who are a little bit elevated, they're much more easily angered. And they're often described as being kind of touchy. Anything you say, anything somebody says, kind of is potentially will set them off. And often they can be now essentially inaccessible, either because people around them really don't want to interact, or they're self-isolating. Remember, I said earlier that self-isolating is sometimes a coping strategy. So because you're feeling distressed, you don't want to distress others, that sort of thing. So irritability, being irritable or being irritated, much more easy, especially as the day goes on. It's kind of worse in the afternoons or evening, possibly even aggressive. That can happen. People get, kind of very defensive and begin to feel attacked, not just verbally, but potentially physically. So people can show just a lack of interest in anything. And then that can lead to anhedonia, which is an inability to actually feel pleasure or get, some sense of just fun or engagement at all. Chronic boredom, a very common thing. People may complain about being bored all the time, and now boredom itself has become a worry. I'm worried about being bored. You're laying in bed this morning, and oh my God, what am I going to do today? There's nothing to do. That sort of thing. Now, cognitive, a lot of simply mental illnesses, depression and anxiety being the 2 biggest, can cause cognitive problems in older adults, and it's not dementia. Okay, but it kind of looks like it can look like an early dementia, being confused, kind of short-term memory impairment, word finding problems. Which is kind of either new or, say, worsening what has already been present. But be careful not to confuse this with the onset of a dementia. Okay, COVID-19 isn't known to, that's not one of the symptoms. But being anxious, being depressed can certainly make it look like someone is getting into a dementing illness. Apathy is a common thing in depression, loneliness, anxiety, just simply worrying, people are just, not tuned in. They have disengaged. Okay. And it can look like they're just kind of sitting there, just, moving through the day without any even visible expression on them. So there's a wide variety of possible physical symptoms, which can seem unrelated, especially if somebody already has a variety of different kind of illnesses and problems. Poor eating and low fluid intake are very common. Older adults with, even starting very early on with the worrying stage, just kind of lose your appetite. And people eat too much or too little. Older adults typically too little. Younger people too much. Getting poor nutrition in either case. Doesn't matter which one, you're getting poor nutrition. And they may be gaining or losing weight. Okay. And that may or may not be visible to, the spouse or family member or caregiver who's with them. Or a profound sadness due simply to lack of socializing. For people who are really social people, say compared to someone who's really not, or you say a rather serious and comfortable introvert, this current situation can be much more distressing. Okay. Excessive chronic worrying with noted signs. What are the signs of, kind of physical signs of worrying? This is the common one we think about, right? Somebody sitting there rubbing their hands. But there's a lot of things and little movements and tics and, frowns and things like that. So a lack of energy is very common, especially if you're not eating or sleeping. Any of us would feel that. But it can lead to little or no physical activity. Now whatever they are doing now, a lot of us were walking and going to the gym and things like that. We can't do that anymore. We can go out and walk, of course, but we can certainly continue to exercise. But a lot of folks they end up with zero activity. And for an older adult, the older you are, the worse that is. Okay. So poor or lessening attention to self and or environmental hygiene, meaning you're not bathing, showering, brushing your teeth, or at least not as much. Your house or your apartment, your room at the care center is starting to be kind of trashed and stuff not picked up. And, you always made your bed and now you're not doing that anymore. So restlessness, which can take a lot of forms. Psychomotor agitation. If I was standing in front of you giving this talk, I'd kind of demonstrate some psychomotor agitation, which is, takes a lot of forms as well, but it's really in kind of unusual or exaggerated movements, and you're not really stopping them in contexts where you should. Pacing becomes common even in a small apartment or a small room, and that increases the fall risk for older adults. Conversely, people can just sit and stare, at nothing, which is really bad, but mindlessly watches TV and then later can't really remember what they just watched. Can't effectively calm self. This is for people who used to this, and now they can't. This is much more serious problems, and this can infect the sleep issue. Okay, if you can't calm yourself during the day, you're likely not doing very well with that at night either. Muscle tension and soreness, even if you're not engaging in this psychomotor agitation, can just kind of come on because we tend to, just right in the beginning worrying stage, we start to kind of locking ourselves up. It's not as visible as you can see me doing now. It can be. I've certainly seen it. But neck, shoulders, and the legs. We tense up our legs. We don't recognize that as much as we do with our neck and shoulders. Increase in chronic pain for existing problems, just more of the same. Maybe an overall sense of pain, you kind of hurt all over, and which kind of leads to an increase in over-the-counter pain meds, okay, which is contraindicated, some of them, in the COVID-19 scenario. Okay, so people will certainly try to hide that increased drug use because they got a sneaking suspicion, maybe I'm taking too much. Okay, so serious signs and or symptoms, the psychomotor agitation and the restlessness to the point of being exhausted. mean, you're physically exhausted from that and pacing maybe and just getting up and down. You can't really sit and relax. Can't go to bed. They may have, maybe because they're just too wound up, they just simply can't go to bed. Or maybe they're kind of typical common night fears that a lot of seniors have, are new and or worsened. Okay. Cognitive signs and symptoms become chronic. They're just not even going up and down. They're just chronic, consistent, or they become a safety issue. They're forgetting to turn the stove off. That's the classic one. The fear of being alone or a fear of being alone is now causing a real strong emotions, usually sadness and crying and that thing, or it can lead to panic. The caregiver has to go, to the next room, and the person really just can't handle even that little bit, or they're on the phone with the family member, saying, something about being alone and they're scared and that sort of thing. Noted physical symptoms, which, now we're kind of getting into the serious anxiety phase here. Shallow breathing, which can lead to all kinds of problems. You're simply not getting enough oxygen. The shallow breathing by itself can lead to some cognitive confusion. Increased heart rate and or blood pressure to unsafe levels. Temperature changes, which are inconsistent with other issues like the temperature in the room or your sense of feeling hot or cold. Sweating, pounding heart, dizzy and or feeling, somewhat lightheaded. A headache, GERD, gastroesophageal reflux disorder. So we're popping down the Tums and everything. Rapid onset of cognitive confusion with any of these. Okay, it wasn't something that was going on with you before, but now you got some higher temperature and some sweating, and you're also just kind of confused. Okay, so consider know your stroke symptoms. Should know them for ourselves. I got white hair too. I know what stroke symptoms are. People, your family members should all know stroke symptoms as well. So, and another thing is serious is depression is now, closely aligned with the anxiety, and may require treatment. If the person has a history of panic attacks, and you don't have, we're talking the caregiver, family member, spouse, and you don't have experience drawing them out of that sense of panic, or you think a stroke is happening, that's time to call 911. Okay, so let's cope with this stuff, and you can. I can assure you, you can do it. Anxiety is probably the most treatable mental health problem. Okay, so first and foremost, of course, acknowledge, yes, we are in a crisis, but it's temporary. Just like other crises we have, both in our lives, our families, or say in the country. Some of you remember we had teenagers in the 60s. Tell me that wasn't a serious crisis, both in your family and the country. Turn off the news. Again, across the political spectrum, these cable TV channels in general have an army of psychologists figuring out how to make you anxious. That is their goal, is to make you anxious, because what do you do when you're anxious? You turn back in, you watch the advertisements, you buy stuff that's being sold. They need you to tune back in. Anxiety does that. And it doesn't do you any good to amplify anxiety from other sources. But, we need the news this time, so watch 30 minutes or so on a reputable, news station, like Oregon Public Broadcasting or, any of the subsidiaries of that. So really, turn off the news. Delete or ignore the news and commentary that comes up on your Facebook page. Half of the stuff on my Facebook page is news and commentary, and I like that. I want it, but I'm not looking at it now. Okay, I'm very intentional about that. So seriously limit engagement and talk and conversation about COVID-19. Yes, we do need to talk a little bit to our family. Here's what's going on. Here's what I'm feeling right now. Those sorts of things. But all day long, 6 hours a day, something. No, that's just, amplifies any worrying and anxiety. But getting more social, how can we do that? Well, believe it or not, your spouse, you could probably have a conversation with your spouse. It is possible. housemates, and them too, whoever they are, talk about the old days. There's a lot of topics that, things we could be talking about. Go through old pictures and tell stories never told before. Okay. Little ones, they can be pretty fun. In like, say, an assisted living or something, people can all come out to their doorways and have conversations from their doorway with what you can see half a dozen or more different rooms. So these are your doormates. Okay. You didn't have doormates before. Well, guess what? You do now. And people are doing that in apartment buildings, even in neighborhoods of single homes, and to very good effect. Develop phone trees, good way to do it. And contact old and current friends. I'm doing that. This is one of my coping strategies. Being via the phone, email, FaceTime, Zoom, Skype, chat rooms. A lot of ways to do that. And use websites. Classmates.com is a great thing to be talking to old classmates. Military units, that's a lot of fun for veterans to get back in touch with their people that they served with. And a real good one, listen. Listen to other people. Okay, even if it's repetitive, listen each time. I could give a whole talk on listening skills, of course, but I won't do that. But be supportive, because you're not alone. A lot of folks going through exactly the same thing you are. So some more coping strategies, learning new things, but especially these day and age, various technologies. How many of you knew what I just said here about, email, FaceTime, Zoom, Skype, chat rooms? If you don't know what those are, now's a good time to learn. Even I could learn it, and my friends and colleagues know. If you start talking anything about a computer to me, my eyes start going up to the top of my head somehow. Even I learned about those. Learn new things or practice former skills, such as languages. Use Babel.com. That's a really good site. That's what I use for Spanish. Musical instruments. If you played it before, you'd be shocked at how fast you can get right back to the level you were when you stopped playing. Expressive arts of all kinds. Former and new hobbies, if available. I know in assisted living and places like that, you don't have your workshop and your bench and all these things, but some creative thinking there. You can get into things. Do things together using this technology, Skype, Zoom. We're on Facebook and Zoom and all these things that you're it's different, of course, but you're kind of together. You can see people and interrupt them and do all the things we do when we're talking face to face. Get up and go to bed at the same time every day. That's good advice for older adults in general. But now's a good time, because creating and following a schedule is very advantageous at this point. And no activity is too small to include on your schedule. Okay. Schedule chores, what time of day, or every morning right after breakfast, then that'd be a specific time. Schedule to include when and for how long to watch television. I see, every cable company and Netflix and Hulu and all these are all got free services and all that, and trying to get you to watch. And that's great. I love movies. But you can do that too much, and it's not good for your body or your brain, but I would recommend targeting comedies, especially if you really are worrying and being anxious. Target some comedies. There's a lot of research that shows laughing is an exceedingly healthy exercise, especially for immunity. Okay. TV and radio. Yeah, you can use that as company. A lot of people do that, especially people who live alone. As long as it's not news and talk, commentary kind of going constantly. Okay. What did you do in the past for stress? You may not exactly say, oh, I did this and that, but you can remember what you did in the past with stressful situations. Well, you might be able to do that same thing now, all things considered. Create or engage in physical movement. This is very important. Make chores fun. If you're capable, dance through it. Now, don't sue me if you fall, but, move around, make your movements bigger, more exaggerated. Get a couple cans of beans, start working them arms and shoulders, and really make some really good movement. Okay, exercise daily, every single day. Okay, it's good for the brain and the body, certainly the mood. Have your juices flowing. Avoid possible contributors to stress. Alcohol, a major stress inducer. Okay, it's not the relaxing agent you think it is if you're having more than one. So limit any kind of alcohol to one drink per day. CBD, great stuff, great medical stuff. I do support its use. Too much, or you're starting to take a little more than you normally do to relax and whatnot, that can actually lead to the opposite effect. Caffeine is a wonderful thing first thing in the morning, maybe, but not throughout the day. Okay. Nicotine can calm some people, but it can induce some anxiety in others, especially if you're starting, used to smoke a couple of cigarettes a day. Now you're up to a pack. That's a pretty bad sign. Okay. Overeating, very common in these days. Lots of Facebook memes out there about what you look like before and after the quarantine, but over-the-counter meds, always too much of that always is anxiety provoking. Helping others is one of the best possible ways you can help yourself and reduce your concerns. Helping others in any possible way. Simply being kind is helping others, and it certainly helps yourself. Being supportive, helping with chores and that sort of things. You're definitely not alone in your coping struggles, not by a long shot. If you're in a assisted living or a retirement home right now, I can assure you everybody in every room is having coping struggles. Helping is doubly important if it's your spouse, family, or friends who need some kind of help. But including strangers, helping strangers is a little more satisfying, at least to me, than helping my own family. And I get a lot of satisfaction out of helping my family. But helping people who need it and aren't expecting it from you, that feels good. Consciously good diet. Now, this is a struggle for me. I'm a diabetic, and I have all the desires, sitting around. When you're bored, you kind of eat, right? Well, you don't eat, a vegetable salad. You have chocolate or a piece of cake or something. But, a good diet without excess calories. But desserts are okay. Don't limit desserts in the middle of all this, Hydration, exceedingly important. For older adults in particular, we lose our sense of thirst, and so we don't drink as much as we used to. That can cause cognitive problems. That can be the single only thing that's causing some confusion in your mind is that you just aren't having enough fluids. And remember, coffee is not in this, because caffeine is actually a dehydrating unit, right? It causes one to urinate more. So you want to consider, not just water, but juices and things like that. But it's recommended for COVID-19, is to make sure you're hydrated. Continue all previous hygiene and habits, okay? If you are a daily shower person, continue to do that. Not because you need it, but because you're continuing this routine and you're continuing life as you used to do it. Keep your space clean and, make your bed. There's a famous speech by some famous admiral who started out, you want to succeed in life, make your bed. Since I heard that speech, I've been making my bed, much to my wife's delight. So delight your spouse by doing that. Okay, so what about nighttime fears? A lot of seniors have little fears at night, particularly those that live alone. But, whatever time of day might be difficult. A lot of folks, have difficulties, in the late afternoons, okay, and not at night. And so whatever time that might be, do things to deal with it. Don't get into bed unless you're ready to sleep. Read, watch TV, do that out of bed. Okay. What about your environment? Well, what works for you? Do you like a real dark room, soft light, maybe light coming in from some other room, a bathroom or another room? You like it warm or cool? You married couples, don't be afraid to try sleeping in different beds. Reportedly, over half of couples actually do that. They just don't tell anybody. Oh my God, it must be, you're going to be on the verge of divorce if you don't sleep together. That is absolutely not true. Prop yourself up in the bed. Now, we know to do that for things like GERD and other reasons, but it can be, if you're having trouble getting to bed, it can help with a lot of things, help you just kind of relax, and some people do it all night if necessary. It helps with breathing and things, and it helps with pain. So we experiment a little with that. TV, in another room or in the same room, or soft music, can really be very helpful. If you're doing a TV, again, having the news in the background, no, not a good deal. Okay. If noise is bothersome, you have plenty of really quality soft earplugs. And something my wife discovered and gave it to me, a new thing. It's called Woody Nose. It's real soft nostril opening kind of devices. I've been using it for 2 weeks, and I can tell you I sleep way better, as evidenced by my enthusiasm today. Okay, so there's the website, woodynose.com. I absolutely recommend it. Okay, so breath work, with, wait, I think I lost a slide there. What the heck here? Oh my God, what happened? Oh, there we go. So coping strategy, create a comfort box. For example, something truly a box even with chocolate or mints and Listerine. Keep the ice cream in the refrigerator. Ginger ale, that's definitely in mine. I buy high quality stuff there. Ice packs, foot massage tools of various kinds. For neck and back in particular. Your favorite books. It can be a Louis L'Amour novel, something that just kind of brainlessly and takes you away into a fun state. Okay, have a retreat space if you got the room. A quiet time or just simply to be alone. Don't be afraid to use it. Now, breath work. If I was going to pick one out of all these various coping strategies, breath work is a really good thing. It's very functional, really successful. You can use it anytime, day or night, to relax yourself. Before bed or in bed if you wake up in the middle of the night. So, the easiest is just simply calm, deeper breathing. You're just sitting there, laying there, just kind of intentionally breathing just a little bit deeper than you normally would. The next step, would be a stronger, very intentionally, much stronger, fuller, deeper, rhythmic breathing. Then, from there you can get into, some real specific kinds of breathing, like the 3-3-3 pause. That means, you're to the count, count of 3, breathing in, count of 3, holding, count of 3, letting your breath out, and then a short pause, and then restart that cycle. Increasing that as able. The best, and this is the one I use, is a system of 4-7-8 pause, 4 breath in, hold for 7, and then letting your breath out for 8. Now what that does is totally empty your lungs, of all this bad stuff that is designed to get rid of, and a slight pause, and then start the cycle again. That's actually a major yogic breathing exercise. And even some yogis will tell you, use that very cautiously because it's so powerful. I don't use it cautiously. I use it as needed, and it is very, very effective. For breath work of any sort, concentrate on the breathing. Think about what is coming in and going out, and then the counting. And your brain, I guarantee, is going to wander off unless you are a high state yoga person. It's going to wander off. Simply bring it back. Don't do anything. Okay, refocus. And keep going. So, something happened there with there we go. So doing breath work with someone else is very, it's more effective, I think, and it's kind of a bonding kind of exercise. And you can lead them through it or them through it with you. You can do it over the phone. You can do it, on Skype, FaceTime, or whatever. Holding hands with your spouse at any time, of course, is a very good thing. And certainly during breath work, if you're doing it with them, that's a very good thing. Men, like, hold hands with each other. Women seem to be able to do that. But just if you're with other guys, just sit closer than you normally do. Now, that's not what we're doing in COVID-19 world. But just look at men, you can look at each other. And when this whole business is over, you can just set the seats a little bit closer. Soft music anytime, even in the background while the TV is going. but especially in the evening or at bedtime. Okay, here's a big one: withholding judgment of others. Worrying and/or anxiety are not freely made choices. Nobody chooses to engage in that sort of thing. So the symptoms, de-stressing, these are learned skills, or rather, coping with the symptoms, doing things very productively for yourself, or de-stressing. Those are learned skills. Okay. Remind yourself this is temporary as many times as you need to do so. Ask for help whenever you need it. Ask for it. Practice smiling. And use the mirror to smile itself. I really mean that. That's a really high level thing that alters our brain waves. I mean, the research is rather radical. I can tell you what, I don't look at a mirror anywhere in any context where I don't smile at myself. That's how ingrained it's become in me. So wash your face. Okay. Feeling kind of stressed, go wash your face. It alters your mindset. That's what it does. That's what it's for. Okay. Do it as often as necessary. I have some clients of mine that tell me I wash my face 15 times a day, and you know what? I don't have any acne anymore. Isn't that something? So find the lesson in all this. I'm not telling you to look for the silver lining, because I don't do that anyway. But there's lessons involved in things that we do, particularly when we do them intentionally. Okay. And always meaningfully say please and thank you. Those are magic words. So give me a whole bunch of questions. I do way better with questions than lecturing. You got it, Don.
Okay, Tim, thank you so much. Oh my gosh, so many tips and tricks and strategies for dealing with all of this during the pandemic. So thank you for that. We did have a question from one of our viewers who says, how does anxiety produce those physical manifestations? They said that they've been experiencing some of the physical symptoms that you talked about, but never really associated that with anxiety. So I don't know if you have thoughts to share on that.
Well, I think first and foremost is that we tend to look at ourselves as our parts of ourselves as being quite separate. They're not. They're not separate in the slightest way. Our physical and mental states are not separate from each other. We describe, different ways in which we feel those things, but they're all part and parcel of who we are and ourselves and what's going on with us. So, just as our pain is a big one, that is a brain thing, right? We can cut off nerves, and so they don't signal the brain for what's going on. But when you're feeling physical things, your brain knows it, and it does things consciously or unconsciously to cope with it. And it's the same way. When your brain is having a very difficult time, or an emotional piece of you is having a difficult time, other things happen. The messages gets transmitted around. And so the worse things get, say like as anxiety, okay, now the body's reacting. Okay, and these are actually positive things, especially in company with others, because if you're just sitting there with a smile on your face, worrying yourself near to death, nobody's going to know. Nobody's going to help you unless you're asking for it. But now these physical symptoms start becoming noted, and those are easier for people to notice. It causes them to jump in and start helping you where they might not otherwise. But the main thing though is these are not separate. Our emotional state, our body, our mental status, they're not separate entities of ourself that we can disconnect from each other at will. They're all together. In fact, trying to disconnect them, leads to problems even more so. I hope that answers your question. I can't see you. I can't see your body language to know that I answered your question well.
Yeah, Tim, I think that was super helpful. I know that the two takeaways for me on that, what I heard you say is, number one, oh my gosh, our brains are connected to our bodies. Who would have guessed? And then secondly, that the physical manifestations actually are productive. They're there for a reason, to signal that we might need help. So to me, two really great messages to take home. I know I hadn't thought about it that way, so I really appreciate that. Okay, so I'm not seeing any other questions from the audience members, but I really, really thank you for all the excellent information that you presented
Oh,
here.
you're very welcome.
Yeah, thank you for being here with us. Maybe we'll get you to come back and do another one at some point. And we want to thank all our audience members for joining us on Facebook and YouTube today. We actually have quite a few people also watching on YouTube, so that's great. And this will also be recorded and available on Facebook and YouTube, so you can share it with others who may not have had a chance to be here with us today. And I want to thank you again, and tune back in at 2 o'clock this afternoon if you have diabetes or you know someone, a loved one who has diabetes. We're going to be talking about with an endocrinologist about how to care for your diabetes at home during COVID-19. So thank you again for joining us, and have a great day.
Thank you.